everyone. Welcome back from break. As we have some open chairs available, if any of our guests who are sitting in the far seats would like to join tables for the discussion, we'd be glad to have you come and fill in seats once everybody's seated back down. And we're going to have another discussion. This one's to be moderated by Andrew Pleasant from Canyon Ranch Institute, and I'd like to invite him up to introduce his speakers.
Tall guy adjustment, thank you. Thanks for staying for the whole day, really. You need to sort of get your energy going again a little bit, maybe pat yourself on the back for persevering, and the offer was not only honest for those of you in the side to come up and join a table, it'll also help with the small group discussions that we're going to have, so really feel free to come in, fill up, and besides it sort of lives up to the principle of health literacy, which is what we're here to talk about today. So as you've heard, I'm Andrew Pleasant. I am the Senior Director of Health Literacy and Research at a nonprofit based in Tucson, works around the world called Canyon Ranch Institute. You'll hear more about that. Speaking with me today will be Jennifer Cabe here, who is the Executive Director and a member of the board at Canyon Ranch Institute, also a member of the faculty at the Ohio State University College of Nursing. Previously, she's worked in the Office of the Surgeon General at the Fogarty Center in health insurance and health communication as well over her career. Joining us electronically, as long as the electronic gods allow, so far so good, will be Dr. Cliff Coleman from the Oregon Health and Science University. Cliff is a leader in health literacy around the world. You'll hear a lot about his thoughts towards competencies within curricula, but it's important that you know that Cliff is also still practicing. He spent the morning today, right up until now, with people in the Richmond Clinic where he works at OHSU, which is a federally qualified health center. So we have some theory and we have a lot of practical examples of how health literacy can inform the training of health educational professionals that I hope you'll find of interest, and then we'll do the group discussions. And instead of appointing somebody, I'm going to ask each table when we get to that point to say who is going to be your report back person, and we'll just see how that goes. So my task is to give you the briefest Health Literacy 101 session in the history of health literacy. We'll see how that goes. It's important to remind you things that you already know, right? Health literacy is a compound word, health and literacy put together. Like many other things, when you put two words that everybody thinks they already know what they mean together, it means something else. This is one of those examples based on everything I've heard you say this morning. This first part you've got, right? That health is not just the absence of disease, that it is a resource for life. Now, while people in this room, I think, very well understand that, it's important to remember when I work in communities, low-income communities in particular, they don't know this yet, right? Health in the larger part of the population that we all work with still is not being sick. So it's still a transition in thinking that a lot of people have to make. The other part of this, literacy, and if I had 5 more minutes, I'd ask you to answer this, but instead I have to, which is too bad, because I'd rather engage you right off the bat. But most of you, I would imagine, are already running the classic answers through your head. Well, it's reading, it's writing. Absolutely correct. Some of you have probably remembered it also includes speaking and listening. And a smaller percentage of you have probably already realized that numeracy is in fact part of this construct too. But it's also more than that. Everyone in this room, I can guarantee you, because you're here and the roles and positions in the world that you fulfill, around 3rd or 4th or 5th year of your formal education, made a transition from learning how to read to reading how to learn. That is a powerful transition where you begin to be able to use those skills to not only inform yourself, but the last bullet there, which is change the world. What we've done all day today is use your literacy skills to try to figure out how to change the world. And so when you put those two powerful ideas together, health literacy, really the sky can be the limit for how you make this. It's not how the idea started. It's a relatively new idea in the world. Everyone here was born before health literacy was ever mentioned for the first time in the peer-reviewed literature, which is in the mid-70s. But if you ask that person, he'll say it was an accident of language. He didn't actually mean it, but the words health and literacy appeared. So when you search in all the databases, you find his article and you think that's the first one, but it's not. So here's where most people think health literacy is. This is where it started as an idea, the problematizing of language within a health and medical context, right? These are classic examples. You still see them all in daily use now. They're all incorrect, right? The problem with take one pill 3 times daily is, when do you take them? Exactly, right? Mom gets up, takes a pill, gets her husband off to work, takes the second pill, gets the kids off to school, takes the third pill, followed the instructions on the vial correctly, could be deadly in some instances. Have any of you ever said in your life, dear, could you please pass the sodium? I didn't think so, right? Trans fat, good or bad for you, the label does not say. If you go to the FDA's website, by the way, and look at the nutrition labels, they color code it on the website, but in practical use, they do not. That's called politics at the end of the day. And radiography, I was in a place just the other day, they had developed the great they sure had the old sign, it was right up there, radiography. How many of you are MDs? Just a quick show of hands, that's about what I thought. Have any of you ever asked any of your patients to go get a radiograph? I haven't been asked to myself either. So what they did was actually put up a second sign that said X-ray, right? So that what the people know is the signage that's used. So this is the basic everyday approach to health literacy, but over the years, it's become a lot more complex. Why? Because the idea of health literacy has grown. It's matured, it's evolved, because it's in this context where there's a lot of complexity happening. And it's not just about language. I love that, Malcolm, we haven't met, but you were the first person to say the word power today. Thank you very much. Health literacy is a way to rebalance the power equation within health, medicine, wellness, and actually society overall. So this, you all know, we've talked about it all day long, right? More health knowledge, new areas of research and practice, more global movement of people, ideas, and, of course, diseases and illnesses and vectors thereof. Infectious disease has been a theme throughout the day, immigrants, the elderly, and the global burden of disease. All of these are the underpinning of the preventable causes that in this country, as somebody mentioned, the 85% of what we spend on preventable diseases. Health literacy, as my title said, is really the currency of the solution to these problems. We also have what we've also talked about today, the increasing complexity of global health systems. Everybody's trying to reform, nobody exactly knows how to do it, but for the people caught in those reforms, they're even more confused now than they were before, even though the reforms are well-intentioned. Multiplication of sources in health information. When most of us were young, there was no such thing as the internet. Now you can find a cure for everything, right, in 2 seconds from anybody. Health insurance has been, seems like it always will be, though it doesn't have to be complex. It could be quite simple. Chronic disease prevention is complex, but health literacy can do that, and you'll hear examples of that today, exactly how it works. Treatment, self-management, and it also extends into acute issues and underpins medical mistakes in many instances. Remember, just because you have an advanced degree does not mean that you have great health literacy. And when you are ill and tired, you most definitely do not. So this is not a them don't have and we don't have issue. This is a everybody has issue and requires universal precautions. This is a quick grab bag of some, not all, of the data that associates health literacy, low health literacy with poorer health outcomes. Some of them are incredibly well studied and would take the rest of the show if I put the citations up. So I didn't put the citations up, but they're out there, trust me. But one that's quite interesting is this right here. People with low health literacy have been shown to receive lower number of referrals for kidney transplants. So that goes to not only the patient's skill, but also the judgment that health professionals are making when they have a sense that people have lower health literacy. So it is very much about power. And it is very much also about how to create an efficient healthcare system and to do so at lower costs. What you can't see behind my good friend Cliff here is people die earlier and they cost more. In fact, they cost a lot more because they always present later and in worse health conditions. So it is, in many lists, I saw a couple today of the social determinants of health, Health literacy is the newest. It's often still missing in the lists, but the evidence is starting to show that when you take account of all the other social determinants of health, health literacy has an effect all by itself, which in one way of saying that would say that health literacy is the strongest social determinant of health. It's also not just about what people do or don't have when they come into a health system. The health system creates the demand for health literacy. So what we're talking about today, the education of health professionals, its success or failure creates the demand for health literacy. That is as important as the supply side. It needs to be a balanced equation. We've talked about balancing things all day long. If you run health literacy, and I hope we'll show you this to you, through all your work, you will see how it really can become the language, the currency, the tie that binds all these ideas together of bringing different health professionals into the same educational stream, receiving the same classes at the same time, because it's this big of a problem. This is the best data in the United States. It's not fabulous data, it's just the best data at the population level right now. And at the end of the day, 88% of the US population is below what they call the proficient level. That proficient level, hundreds of studies prove, is the level of health literacy you need to successfully navigate our healthcare system. So the other trick about this study is that 3% of the people, they had to toss out of the sample because they couldn't respond in English or Spanish. So if you put that back in, it's over 90% of the US population that doesn't have the health literacy that they need to survive every day. Here's the correlation to health status of that same data. The relationship is very clear. The lower your health literacy gets, the poorer your health status is. But notice the opposite effect, which most people ignore. There are people with low health literacy who have managed to have great health. And then there's the people who have high health literacy who have great health. Both of those populations are seriously understudied. And they're the ones that have figured it out. Most of the research has looked at the deficit, the people with low health literacy and all the things that they can't do. And that's fortunately starting to change. In Europe, you see the exact same relationship. The numbers are slightly different, but not enough to really think that there's a difference in health literacy, either based on health system design or culture or educational system. You're still talking 83% who are not at the excellent level of health literacy. And again, here's the relationship with health status. It's clear and undeniable. There are many definitions of health literacy. This is the one I'm just going to show you. Why? Because as far as I know, it's the only one that's actually been used to design an intervention that works. You'll hear about some of this. And this is the complex approach of health literacy. It's not just language. It turns into a roadmap for behavior change, right? It is a theory of behavior change. Now, it's based on fundamental literacy. You can follow this roadmap, but if your language is bad, it's not going to work. You can follow this roadmap, but if you don't get the science right, it's not going to work. If you don't pay attention to culture, it's not going to work. And if you don't pay attention to power relationships and the resources that people have access to, it's also not going to work. But when you align all those, which is not impossible to do, and think, I'm going to help people find information, I'm going to check in that they understand it, and then I'm going to help them evaluate it in their own life. Because it's one thing to tell somebody they have type 2 diabetes and need to go on metformin. It's another thing to figure out if they actually can. The gap between what you know and what you do is solved by health literacy. The next step people have known in some circles for a long time. Al-Anon's a great example. You want people to change their behavior, they have to say so. They have to tell their friends, don't offer me a cigarette. I'm going to quit smoking. I'm going to start jogging. They have to create that awareness around them to use their power to make room for the behavior change that they want. And then we've shown that people will actually use that information and change their behavior. This is the Calgary Charter on Health Literacy model. That URL will take you to it. You can read the whole thing. It was written collaboratively by hundreds of people involved, and you can actually add your name if you want. So what's going on in health education around the world? I'm going to go through these way too quickly. I think the only thing that you really need to notice is the number of countries that are starting to put health literacy into their training of health education professionals and the diversity of the fields, the professions that are actually doing it. So it starts with the International Union on Health Promotion and Education. They're really focused on continuing education. Health literacy is a continually emerging strong theme in that international network. And then just by country, Australia has always been strong in health literacy. You see it not only in health, but in art, right? In Australia, again, a different campus, health education, the health sciences, Belgium, public health, psychology, nursing, and Canada. Canada is another strong country historically in health literacy studies. Community services, public health again, nursing, podiatry, physiotherapy. Public health is probably one of the most frequent. In Germany, it's in teacher training. Why not? Because as someone said earlier here today, you want to get this to start with the kids, right? Start in school and make the problem go away that way. Social work, sociology, health promotion, physician training, nursing. So it is really starting to appear, and that's just a quick little list that I grabbed just from the people who I know who study health literacy around the world. If you want to read more, you can look at these 2 workshop summaries and commission papers that, as far as I know at least, detail the appearance of health literacy not only in health professional education, but in practice, in the media, society at large, governmental efforts. They're all pretty well documented there. So with that, that's my 10-minute introduction to health literacy. And we're going to turn it over now to Dr. Coleman. And this will be called the technological break here while we do the switching.